Great. I'll hand over to you now then, Salmanesh.
Thank you so much, Jenny. We have 3 minutes. We'll give some time for everyone to join, and then we will start by 7 p.m. East African time. I don't think we have Andrew yet. I'm just waiting for one of our panelists.
Yeah, it's only just 4, isn't it? So we can give it another. Oh, Andrew looks like he's in the waiting room. I'll admit him. I've made you a co-host, Salmanesh, just in case something goes wrong.
I was just going to ask. Thank you, Jean. Okay, I guess we can start. Thank you all for joining our session. I'll just start by screen sharing my introductory slides. Let me know if you are able to see them.
Yes, we can see them, Salmanesh.
Okay, perfect. So welcome to the Eastern African Academies of Childhood Disability session time as part of the International Alliance Academy of Childhood Disability Global Professional Education Committee listening and sharing session. We'll be talking today in the theme, what do adults with disability tell us about their childhood? And in part of celebrating International Day of Peoples with Disabilities. So I would like to say welcome to everyone. Before I go on and open the panel discussion, I would like to share some ground rules. So all recordings will be posted on the IACD website to public access. And if you do not wish to be recorded or would like to remain anonymous, please keep your video off through the session. Do not comment within the chat during the session and rename yourself as a participant. By actively participating, you consent to your appearance and comments being recorded and to all future users of this recording. We hope we would be able to see all of you on video, and we hope to have your consent to have a lively discussion. So the Eastern African Academy of Childhood Disability will be using this time from 7 to 8 p.m. East African time to have a panel discussion on a topic, our childhood, what happened, and what could have been different. And I would like to say a few words on who we are. The Eastern African Academy of Childhood Disability is one of the Academy members of the International Alliance of Academies of Childhood Disability. And it is a professional consortium of experts with a vested interest in the diagnosis and treatment of childhood disabilities. It was established in 2015, and the EACD is dedicated to enhancing the health outcomes of children suffering from disabilities. With the mission to promote research, education, and best practices in the field of childhood disability, the association brings together leading healthcare professionals and researchers from across Eastern Africa to foster innovation and collaboration in the field. So the organization membership comprises individuals hailing from Burundi, Eritrea, Ethiopia, Kenya, Rwanda, Sudan, South Sudan, Tanzania, and Uganda. For further details, please feel free to email us at eacd.group@gmail.com, and we will be responding quickly. These are the EACD leadership, the executive members. We have our chair, Dr. Susan Wamiti, and our vice chair, Dr. Catherine Oyek, and Eva Naputeni is our secretary. I am Salamini Stege, and I will be moderating this session for today. And I'm also the promotion chair of the EACD. One of our panelists here today, Perpetua Omandi, is the treasurer, and we have parent representatives, Dr. Sylvia Muchabo and Safia Ibrahim. And again, one of our panelists here today, Andrew Kassiani, is members chair. So these are our panelists for today's session. I will briefly introduce our panelists and open it for the panel discussion. So our first panelist is Mr. Andrew Kassiani. He is a person with lived experience and also a professional in the field of childhood disability. Mr. Kassiani is a licensed and registered occupational therapist practicing in Nairobi, Aga Khan University Hospital, with over 10 years of experience in the field. He is also director of the WellStand Rehab Services, a member of the Kenya Association of Occupational Therapists, and of course, a member of the EACD. He is skilled in a variety of pediatric evaluation tools and treatment approaches, including sensory integration therapy, therapeutic listening, and neurodevelopmental techniques. He is well experienced in using a wide range of standardized and non-standardized assessments to identify strengths and weaknesses in areas such as handwriting, fine and gross motor skills, visual perception, and sensory difficulties. Overall, Mr. Kassiani uses a systematic biopsychosocial, whole person, whole life, and self-management approach based on evidence and clinical reasoning to support children and adults to participate as fully as possible in the activities that are meaningful to them. Mr. Kassiani is here today to share his childhood experience with us. It's an honor to have you, Mr. Kassiani.
Thank you so much.
Our second person with lived experience is Mr. Nicholas Ndungu. Mr. Ndungu is a proud dyslexic and founder of Mr. Autism Kenya 2023, Nicholas Dyslexia Advocate YouTube channel, and YOS Forum, which works on raising awareness about dyslexia and autism through inspiring story sharing. Mr. Ndungu is currently at his Year 11 education level, and he has chosen to homeschool to complete his high school exams. Alongside, he is learning computer skills in animation at Talanta Institute and is also part of the Neurodivergent in Tech training program at Strathmore University, focusing on information computer technology. Mr. Ndungu is talented across various ventures. He is an entrepreneur, trader, a student, mobile app developer, musician, public speaker, and one with a passion for fashion and design. He enjoys dancing, acting, swimming, golfing, cycling, farming, meeting new people, and traveling. Wow. Mr. Ndungu hopes to inspire others by showcasing the incredible potential and abilities of individuals with autism and dyslexia, and today he is here with us to share his story. We are honored to have you, Mr. Ndungu.
Thank you.
We have a third panelist, but I just want to make sure if Mr. Amos Mutsuoki is here before I make the introduction. I can't see the other side of the screen, so if Mr. Amos, if you are around, please shout. Okay, so I will pass to our professionals. To hear their professional experiences, we have Ms. Perpetua Omondi and Dr. Susan Wamiti. Perpetua Omondi is an occupational therapist practicing in Nairobi, Kenya. She is founder of Dynamic Occupational Therapy Ltd, a company that takes pride in providing child-friendly and fun in-school and telehealth occupational therapy services. Ms. Omondi has over 13 years of working experience with, to name a few, students with autism, ADHD, dyslexia, Down syndrome, dyspraxia, and cerebral palsy. She is passionate about helping students in reaching their potential. She advocates with parents, teachers, organizations, and policymakers how to understand and work with those abled differently. Ms. Omondi has done multiple workshops and talks with various institutions and organizations. To name a few, this includes Google, Britam Insurance Company, Occupational Therapy Without Borders, Kenya Autism Alliance, Inclusivity Education, the Association of the Physically Disabled Kenya, Gifted Dream Foundation, the Action Foundation, Special Education Professionals, and Andy Speaks for Special Needs Person. Amazing. Ms. Omondi, we are very lucky to have such a dedicated professional within the EACD, and thank you for joining this session as a panelist. Last but not least, our second professional panelist is Dr. Susan Wamiti. Dr. Susan Wamiti is a consultant developmental pediatrician and assistant professor at Aga Khan University Medical College, East Africa. Dr. Wamiti attended Birmingham Southern College, Alabama for her undergraduate degree. She proceeded to St. George University, Grenada for medical school. Dr. Wamiti completed her pediatric residency training at Aga Khan University in Kenya. She proceeded to the Holland Bloorview Kids Rehabilitation Hospital, University of Toronto, for her developmental pediatrics fellowship. She is one of the very few developmental pediatricians in East Africa and one of my role models. And she established the first developmental pediatrics service at Aga Khan University. Dr. Wamiti is the chairperson of Eastern African Academy of Childhood Disability and Early Childhood Developmental Project Director of the Kenyan Pediatric Association. Dr. Mwamiti is a member of the International Pediatric Association, Early Childhood Development Committee, and the Governing Council of the International Alliance of Academies of Childhood Disability. Dr. Wamiti was recently appointed as the chair of the Early Childhood Committee for the East, Central, and Southern Africa College of Pediatrics. Dr. Wamiti has collaborated locally and internationally on COVID-19 task forces, research projects, and educational stations in the field of childhood disability. Wow, Dr. Wamiti, we are very honored to have you here, and we are lucky to have you within the EACD. Thank you for coming. So thank you everyone for attending this session. Again, to engage further, please do email us. I will stop screen sharing now so we can see each other and proceed to the panel discussion. Okay. First, I would like to ask permission for use of first names for ease of communications throughout the panel. Do I have your permissions, our panelists? Thank you.
You have my permission.
Thank you, Nicholas. So each panelist will have 3 minutes to respond to questions, and I will show you thumbs up when you are left with 1 minute. I will ask my first question to Mr. Andrew and Mr. Nicholas. So looking at the title, Our Childhood, what happened and what could have been different? What kind of things come to your mind? Can you tell us a little bit about your childhood experience? We'll start from Mr. Andrew. Thank you.
Hello, everyone. Yes, my name is Andrew, and I'm an occupational therapist by profession. I had a couple of challenges while growing up from a very young age. I already knew that I was different. I was not like everyone else. I used to see things differently, view things differently. Most of the time, it used to get me in trouble with other students. It used to get me in trouble with teachers because I always used to do things very differently. I used to be very hyper. I used to have a very short attention span. I used to never settle down. I had issues with tactile issues where, for example, if I touched an old file, it used to really irritate me. And some of these are some of the challenges that I used to face when I was growing up. There was a lot of stigma in relation to how people used to view me as a person. And for me, it didn't really matter because basically the world was my playground. So it never used to really affect me, but it used to affect my parents a lot. With time, I learned how to understand by observing. I learned the only emotion I understood best was anger. And whenever I used to get angry, I used to like really get angry, and at least either I throw a tantrum or throw something at you in order for me to calm down. But with time, I learned how by observing how people operate, what is socially acceptable in the society, and that helped me cope. And I learned how to hide and mask everything I'm going through, which has helped me through the years. At a very early age, I knew I could not work in an office setup, so I told that to my parent, and when I was roughly 6 or 7, 8, almost 8 years. And my mom thought I was crazy. So she didn't understand. When she asked me what I wanted to become, I told her I would rather become a policeman. Later, I saw that people were being sued. I told her I would rather be a mortician because a person is dead and there's nothing they can do to you. Later on, I decided I wanted to be a footballer. And that's what helped me cope, because there's some level of discipline in soccer and teamwork. That's one of the things that helped me cope, get to the point that I am. Later on, I became a obstetrician, and then later on, I became an occupational therapist. That is how my early stages were. Yes.
Thank you, Mr. Andrew. You spared us 30 seconds. So I will go to Mr. Nicholas. Same question. Let me know if you'd like me to repeat it.
Hello, can you hear me?
Yes, we can hear you.
So my name is Nicholas Dongo, and I want to say first, thank you so much for inviting me to speak here. And the current neurodivergence Mr. Autism Kenya 2023. I'm not the founder of Mr. Autism Kenya, but I was being crowned by another organization called Red Areas Foundation. So it was this a competition for all autism and neurodivergence to join together, and also to advocate by using beauty pageant, and also that's how I got the title on April, and I'm really grateful. And my challenge where I was growing up, where I was a child, it is in the normal school, it was very difficult. I was in baby class. First, the students and the teachers, they did not understand what I'm going through. And also, they did not teach me how to read and write. They keep telling me to rub the board, to do some work without teaching me. They think I'm stupid, or they think I'm not able to read or write. After that, I moved to a upper class. It has become worse. The students, they keep bullying me because of I have dyslexia. They always say you are stupid, you are nothing. So I lose confidence. And also, when I was a child, also my mom keep tying me on the bed. That's what she told me all the time. Well, because of my hyperness, I had hyper, and I'm all over. So she always tie me in the bed and keep me lock out in the bed, so she cannot disturb her. And also I keep disappearing in the supermarkets and running off. That's what she told me, but I cannot remember all those things. Yeah. And in high school, I joined another special needs school, which they helped me to now start to read and write and know my future. I wanted to become a pilot. That is still my dream, and also my dream is now to advocate for youths with the learning disability, and how I can help them to achieve those different things. And I've started now to a founder of two business called Nicholsville Dyslexic Shamba Village, and also Nicholas Dyslexic Community Ability TV. Yeah, thank you.
Perfect. You are right on time, Mr. Nicholas. Thank you so much.
Thank you.
Yes, thank you so much for all that brave sharing. It's a lot to happen to a child, and a lot of courage that we are seeing within you. Thank you for sharing. Um, so now I would like to ask our professionals here, Dr. Suzanne Wameti and Perpetua, in line what Mr. Nicholas and Mr. Andrew shared with us, does this resonate to what you are seeing in your current practice? What are some of the challenges you see when you are working with children and adolescents with disability? Dr. Suzanne.
Thank you, Perpetua. Thank you, Salamanesh. And I just want to thank Andrew and Nicholas for sharing their childhood. And what they said really resonates with what I see in my clinics because of not being understood, especially in the school setting, where, as Nicholas shared, with regards to the name calling and being misunderstood in terms of children's abilities. And that is something I do hear as challenges that are shared by our young adults and adolescents who are able to tell us their journey. And I'm also reflecting on what Andrew said with regards to the stigma affecting his parents, because sometimes the children are enjoying their world, as Andrew shared, but you'll find that the parents are the ones who get talked to by the teachers or talked to by family members with regards to the children's behavior. And so for me, it's just reflecting on how much support we need to give the caregivers through this journey. And then also, of course, as Nicholas has shared, how do we get a supportive school like the one Nicholas joined that finally saw his ability and supported his ability to read and write, and educating our teachers, because it's the same story across the board that I see with my patients. It's resonating how like 20 years later, it's still the same thing that's going on in our community. So that's what I'm reflecting on. And then the other thing was with what he shared for parents who don't understand their child, how Nicholas said that he used to be tied on the bed. So there are some parents who misunderstand their children's behavior, and that leads to sometimes punishment where the child is getting hit. So Nicholas's was of the tying that he's described, but there are other families who don't know what to do and they think it's a discipline issue. And so it really resonates that this amount of years later, it's still the same story. That's what struck a chord with me. Thank you.
Thank you so much, Dr. Susan. Ms. Perpetua.
Thank you. From the wonderful sharing and straight from the heart speaking, what I picked was the difficulties with sensory processing, as Mr. Andrew had highlighted, the feel, the tactile issues. So I agree, we get to see difficulties with sensory processing. So that one is quite agreeable that some of our students are having that sensory processing challenges. And then emotional reactivity, where he would get annoyed and throw items. So emotional reactivity is something we see, and many a times we do not know how to handle when a child gets emotionally reactive, where we should respond and not react. As practitioners, as parents, as teachers, we should be able to go in that dimension. And then also from Mr. Nicholas sharing, I got to pick the aspect of fine motor challenges, where in his primary school years, he wasn't taught how to write because they did not believe that he could be able to get it. But also Mr. Nicholas' story is quite nice because there's that comeback, the neuroplasticity is never gone completely, that he was able to relearn that he can in high school, and he was able to write and now go to university. So that one was something that really was encouraging, that you are able to have that comeback for a student. And then aspect of social engagement, the low confidence was brought about due to the stigma. And that one is quite seen, that children who have any difficulties within any school environment, they're having difficulties. And also the lack of enough personnel like therapists, because we can see from what they're sharing was none of them had interacted with someone who was able to understand them and know them. And it is interesting also that the parents had not yet met people who can be able to work with them for a pretty long time before they got any form of intervention. So either the lack of awareness of where to get help from, or even just the lack of the low number of the people who are able to help the students. Then the school setup is quite an important one, because both highlighted the challenges and wins they experience, especially within the school setup. Yes, and play playing in the playground, and children enjoying their play. So that's what I can highlight. Thank you.
Excuse,
Justina, if you could mute yourself, please. Sorry, just give me one. Okay, they muted themselves. Thank you.
excuse. For just a little bit, I need to make some few corrections.
Thank you.
In university, I went for a short course, which one is for neurodivergence for youths to join in ICT. So I'm not in a full course, but I'm just in a short course. Yes.
Okay. Thank you so much.
But and also in high school, I did not do the complete full high school exams, but I want to continue doing more exams.
Thank you so much, Mr. Nicholas, for clarifying those points. And you have such an amazing, rich experience, and we are very proud to hear everything that you have accomplished. Thank you so much, all. That was a really great sharing, and we have seen all the courage and standing for ourselves that Andrew shared with us, and Nicholas has shared with us how he had gone through a lot of challenges which are could be very difficult for a child to pass through. And thank you, Dr. Susan and Perpetua, for emphasizing on the importance of neuroplasticity, school setup, play, social engagement, and how stigma has still remains a big challenge in children with disability. So one thing that caught my thought was when Dr. Susan says how it's the same 20 years later. And so far, you all have highlighted the challenge as a person living with disabilities. Mr. Andrew and Mr. Nicholas, can you share with us what you wish had been different? How would that have made a difference in your life? If what do you wish had been different in your childhood? Mr. Andrew, we can start.
What could have been done different is I wish there was more awareness. I also wish that people would have taken time just to try and understand me. People shouldn't be quick to judge and think that you're naughty or you're just stubborn, because the more people do that, the more they push you further into your own world. And that there should also be some level of counseling for both the parents and also the child, just to help them cope. And the education system should be tailored where it could help these kids get reach their full potential, because these kids are very talented. Whatever they choose to pick, do, whether it's interior design, which I have been able to do a bit, whether it is cooking, which I was a pastry chef, whether it is sports, which I was also playing soccer, which I played for a national team for one of our local teams in Kenya. These kids have a lot of potential, and there's a lot that can be done. That's it.
Thank you. Mr. Andrew, for yourself, what have you specifically wished would have been different?
For myself.
Yeah.
People
What
just
would
taking
have
time.
been helpful?
If people just took time to just understand me as a person, instead of just being quick to judge, not really think about what I might be going through, because we are constantly trying to fight with the sensory issues and a lot of distractions all over the world, and just to be able to channel our energies to where we want to go, what we want to do.
Thank you so much, Mr. Andrew. Mr. Nicholas?
So thank you so much, Andrew. Just like Andrea said about more awareness, and also if even other schools have a chance to learn like differently like skills, all special needs will learn new things, and also to write and read and also spell is difficult for all of us and also for me. But what it will help other youths is more skills, and also it will engage them. Like example, CBC in Kenya, it helps a lot for other youths, other kids to learn and to understand activities. And also if that CBC came to my time, it would be for me to be much easier. I will be exploring new things. I will be learning new things. Yeah.
Excellent. Thank you so much for sharing that, Mr. Nicholas and Mr. Andrew. Now I would like to ask our professionals here, in line with what Mr. Nicholas and Mr. Andrew shared with us, what would you say are the things we shall or we could do differently as practitioners to help things be better for children with disability? Dr. Susan.
Thank you, Manesh, and especially for Andrew and Nicholas. So it's really resonating with what they have said, is that how do we raise awareness by whether it's these educational sessions, whether it's going into the school session, into the school settings as practitioners, because we do get invitations by schools to go and speak to the teachers. And I think it's for us to honor those invitations so that we can be able to help them understand the children and the difficulties that they're going through. And, you know, with Andrew saying that when they're not understood, they are pushed further into their own world, we want to include an inclusive education. And as Nicholas has said, the new competency-based system is probably a better education system that has been introduced, where we're looking at children's strengths and building up on those potentials. And then what we can do differently is for us to actually work hand in hand with the schools and not separate, this is health and this is education. We're all working together to maximize the potential for these children. Inclusivity means helping the other children in the class understand the child by practicing kindness, helping those children understand, even in the home setting, in the neighborhood, that parent who sees the neighbor bullying, can we be each other's keeper and each other's brother's keeper in the neighborhoods? And so for me, it's just how do we raise awareness to do things differently? How do we break the silos between education and health so that we're all working together to reduce the stigma and to create inclusive environments, both in school and the healthcare systems, and even for our healthcare practitioners who we refer our children to? How do we educate them to be able to understand that child who's coming in to be evaluated and you've never met a child with autism before? So it really is a society perspective in us being each other's keepers and raising awareness on those differences and helping children achieve their potential. I love the fact that Andrew talked about joining a national soccer team and his parents being able to push him to be able to reach those heights. They have the gifts. We want to push that to happen. Same with Nicholas, and saying that the youth of this country who have special needs need to be given an opportunity to shine and develop their potential. Thank you.
Thank you so much, Dr.
Thank you.
Susan. Perpetua.
Thank you. I'll pick it up where Dr. Susan left. I would say community involvement in terms of the awareness. So when we look at the entire community, we look at the surrounding of this child. What is their community? Where do they spend most of their time? Apart from school, at home, where else do they
Sorry, Perpetua.
spend time? Where does this family?
We just lost
and one
you
of
for
the
a second. If you could rewind back
Okay.
a little bit.
Okay. Is it now clear?
Yes. Now we can hear you.
Okay. So I was saying in aspects of community, We just look at where the child is. Like if we localize the child, look at the community around, where do they spend time? Where does the family spend time? So creating awareness in the entire community. And I like the idea of medical practitioners coming into the school settings, and we can have a more multidisciplinary approach. So you can imagine if all of
Sorry, Perpetua. Maybe if you put off your video, that could help. With the, I think it's a connection.
Okay.
You
Yes.
were just talking
So in
about
terms of
medical
the
practitioners coming to the school.
Yes. So when we come to the school, if we can be able to take a transdisciplinary approach where we have every practitioner on board and we get them to be able to come and we save the parent time to move from all of us, it will be very good. And then also in terms of talent development, if we can be able to look at a strength-based perspective and pick up the strengths at an early stage.
Thank you so much, Perpetua. Those are great points. And I'm hearing a lot of wordings which tells us to work together in collaboration with children and adolescents with disability and families of those children. And it's not working for them, but it's working with them. And I really love all the points that all of you have shared in terms of creating more awareness, improving the education system, making it more inclusive education. And I love what Dr. Suzanne said, that inclusivity is not only helping the child with disability, but it's helping the other child to understand this particular child. And I love how Nicholas emphasized on enhancing skills to explore new things and give them opportunities. And I will quote Andrew and say these kids are very talented. They have a lot of potential, and we should create the opportunity for them to work on this. Thank you so much for sharing. Now, my next question is for the whole team. Given we live in a resource-limited setup, what will be your recommendation to make life better for children with disabilities in Africa? So we are bringing it to our continent. I will start with Mr. Andrew.
I believe what we can do first is just to create awareness so that we sensitize everyone, every member of the society. Secondly, we can, when it comes to...
Sorry, I cannot hear you.
We can start by sensitizing everyone in the society so that they can be able to understand and know what these kids go through and the challenges that they face and how they can assist them. We can try and make a system where all people work together towards the same goal. And lastly is we can use what we have locally available to assist these kids in order to just for them to improve their skills in relation to therapy.
Thank you so much. Those are really great points, Andrew. And thank you. Of course, we need to sensitize everyone. Nicholas?
Please repeat the question again, please.
Sure. So given we live in a resource-limited setup, what will be your recommendation to make life better for children with disabilities in Africa?
Okay. First, one of this like this conference, you can try to invite the youths to come to join the webinars conference so they can learn. Second is technology, how we can help other youths to learn technology. Like for me in Strathmore, I'm learning technology, how to develop an app, how to get more skills in the university. And also we can start, the parents, they can start to bring them together and expose them to different activities, like work with them in their right path. Do not close them in the house or in the room. And also, even like right now, I'm in Dar es Salaam, I have a conference. We can now start organizing more conference for the youths to join. Yes, and also business. We can start. They can start their own business. Yeah.
Thank you so much, Nicholas. And I think this is also some of the work you do within your advocacy project. Am I right? And you can use a minute to tell us about that.
Sorry.
And I think this is some of the work you do in your advocacy project. And I will invite you to tell us a little bit more about the Nicholas Dyslexia Advocacy Project.
Okay. In my non-professional profile in my community organization is all about going to visit schools, talk to the youths, how they're facing, how their challenges, and if there's any challenges, I try to help them or try to understand them. I give them encouragement, and also I show them the right path. Like if they're in a high school, they're about to finish, I show them how to transit in that space. And also in my YouTube channel, where I show more skills and how they can grow themselves, how they can how they can start their own business like farming or their own skills. You can check on it. It's called Nicholas Dyslexic Advocate or Mr. Autism Kenya 2023. Yes, I'm also in all social media, Mr. Autism Kenya 2023.
Thank you so much, Nicholas. Congratulations for all what you have done for our children in Africa.
Thank you.
Perpetua, I would like your comment on the same question.
Okay, thank you so much. Picking up from where Nicholas and Andrew have left us, I would say more collaborations between already existing structures. That is, for example, the Ministry of Education, Ministry of Health, Social Services, and associations. Because currently we, as the Kenya Occupational Therapist Association, we had a conference, and then we were able to do, like the first day, we were able to offer services to the community around where we did our conference, and it was to a big number of people because of that collaboration. So if we're able to collaborate, we'll save on resources of the families and adolescents, and then still the resources of the state. That is one. And then the other one is also collaborations within the various social groups. We have very many. And then if we can be able to have them collaborate, they'll be able to help us to be able to reach out to many. And then one more thing is adaptations, being able to adapt our environments, our toys, our resources, so that they can be able to fit within our local context.
Thank you. Thank you so much, Perpetua. Those are really great points. And of course, we need to collaborate a lot. And we do have the icebreakers here in our panel discussion. And I'm sure there are a lot from the audiences here that have not spoken, but have been doing a lot of great works, and collaborating among each other would bring like the biggest outcome. I believe that. Thank you so much. Dr. Susan?
Yes, so I like what Perpetua said with regards to like the ministries working together. And for us, I feel like in academia, if we generate data showing the burden of the conditions, then resources can be channeled towards, whether it's within those communities, getting more people hired, whether it's occupational therapists, a speech therapist, inclusive education. So for us in academia, I feel like you generate data, you give government evidence that there is this burden, and how do we allocate those resources? And I really liked what Nicholas said, is that what we do for our youth, this technology that's, for us in Sub-Saharan Africa, we find that technology is being used a lot. And can we take advantage of that platform to raise awareness, take advantage of that platform, because we can reach each other from all over the continent. And those are avenues to teach, whether it's courses that we are giving, whether it's, raising awareness. So technology is something that we really need to take advantage of in our setup. And then lastly is for government to give tax relief for caregivers in Africa, because we find in other countries, caregivers will get tax relief just because of all the resources that have been used to help this child achieve the developmental milestones. So Kenya has done great strides, because at least we have those tax relief for adults with disabilities. But I feel other countries need to do the same for those who don't have that. But especially caregivers, we still don't have those tax relief. So I feel partnering with governments as associations gives us an avenue to help the resource limited setups that our patients are growing up in. Thank you.
Amazing, Dr. Susan. Yes, you have touched on the system, the government, the community as a whole, and thank you so much. I know this is a big topic and there is a lot to say about, and we can go on for many hours discussing this topic. I would like to bring it to my final question and give few minutes for the audiences to participate. So I will finally give each panelist a minute for a concluding remark and a statement on what is one thing you would like to change for children with disability. What would you like to see in the future? So you can say one thing in 1 minute. Mr. Andrew, I'll start from you.
All I would say would like inclusivity, awareness, and more opportunities for these kids, because they're angels and they can do a lot.
Amazing. Those are really important pillar stones that you have mentioned, Andrew. Thank you. Nicholas?
I want to say I want all the youths to now start to join in university, and also university to give them a chance. So we know as we can do great things in the future. And also in the business, also they can make their own money. They can be helped by somebody. Yes.
Amazing. Yeah. Give them a higher education opportunities. That's one thing we definitely lack in our continent. Thank you so much, Nicholas.
Yeah. Thank you too.
Perpetua?
I would say more of the implementations of policies, and where policies are lacking, more policies that would help our children, wonderful children, be included within all our settings. And then more opportunities for those practitioners who are specialized to be able to work with these children. So we should not have practitioners who have trained and they're not lucky, they don't have jobs, and yet the need is there. So those are the few, because it will trickle down to the well-being of the children.
Amazing. Thank you so much, Perpetua. That is very important, and the push should come from all of us, and that will change all the policies, I believe. And we have come a long way in Africa, and we still have a lot to go for. It's like what Dr. Susan said, 20 years later, things still feel the same. Yes. Dr. Susan, I'll give you the final remarks.
So for me, I echo with everything else the panelists have said, but I really feel we need to practice kindness. So wherever you are, in the school setting, in the communities, in the supermarkets, that child who is having a sensory overload and is scared and anxious, be kind to the parent by not saying unkind things. Practicing kindness for me, for government, is allowing those tax reliefs and breaks and allowing our communities to be able to thrive. Because when you look at economic capital that we are all contributing to, you cannot leave anyone behind. So no child left behind, and practice kindness are my parting shots.
Thank you so much, Dr. Susan. That's really, really a very strong words. And definitely kindness is not only through words. We showed, so be aware of all your body language and how you look at the child as well. Thank you so much. These are all great points. I love this discussion, and I hope our audiences have been enjoying so far. We have 7 minutes. I would like to open it for the audiences for any questions. I haven't been following what has been written on the chat, but it looks like there has been a lot of discussions going on. Please feel free to ask questions. Yes, Victor Juma, you have your hands up. Please go on. Victor, you are unmuted, but I am not sure if you are speaking.
Can you hear me?
Yes, we can hear you now.
Thank you very much. Sorry, I was saying, I believe that one best philosophy from solution-focused therapies says that words are very important in designing the perception and response that anybody will give you. So it's my call to people like Dr. Susan that it's a high time that we, put in place a process of actually breaking news about the diagnostic labels to families, because I think many families are hurted there. So it's good to put up a team, maybe a team of counseling psychologists, whoever, that can actually prepare any family that actually receives a child with, any special need, because from there is where this journey gets determined. Yes, thank you very much.
Thank you so much, Victor. That's very important. And I was also just looking at what you have commented on the chat on breaking the diagnostic labels to families in a way that prepares their support journey. That's a great point, and that goes with the kindness Dr. Susan has been mentioning. Anything our panelists you would like to add on what Victor has just shared?
I just want to add, and he's very right about the psychologist, but we need to break the stigma, because whenever you tell most Africans you need to get some counseling, someone to support you, they perceive it as a weakness. And so I really feel we really need to raise awareness on what is the role of that psychologist. And as Victor said, putting in words that what is that person trying to help you with, and it's not a sign of weakness when we refer you to the psychologist to walk you through this journey. So there's a lot of work that we need to work with the mental health specialists in breaking down the stigma and why people decline those referrals, because we refer with each diagnosis, but whenever I circle back with a psychologist, like no one has even called me or come. So that stigma we need to break in our continent as to what are the roles of the psychologists on the scene. But very good point, Victor. Thank you.
Thank you so much. Anyone with a question?
For me, what
unmute. Yes, Nicholas.
I've understood what he says, and yeah, I just agree. Yeah, I don't have any what to say.
Thank you, Nicholas. Any questions from the audience? This has been a very interesting discussion. I really thank our panelists, and I would say people who's lived experience, who are also professionals, and who has indulged themselves into the profession in childhood disability to change the world for children with disability in our continent and across the world. And I really appreciate Mr. Nicholas, Mr. Andrew, your work extends beyond what you are doing in Africa, and I really appreciate all your commitments and all the challenges that you have passed through and how you turned that into a positive learning point for your fellows and for other children in Africa. Thank you so much for all your dedication. I really would like to thank Dr. Suzanne and Perpetua for all your professional sharings, and I can see within your expressions that you do live the life with along with our children with disability, and it is this kind of professionals that Africa will need, and it is this kind of professionals that will bring change in the future as well. And I will really like to emphasize on collaborating and working together with families and children and adults and with disabilities. Thank you so much all for joining us. If there are any last minute questions or any last minute thoughts you'd like to share with us, please feel free to email us at on our email that I just have shared. If one of our team member could share it on the chat, that would be really great. Thank you so much, everyone, for joining us. And please do enjoy the 24-hour sessions by the International Alliance Academy of Childhood Disability. There will be another session after this. Go and look at the country and join. After all, we are all world citizens, and we all work together to change what we can for children with disability. It has been an honor to be a moderator in this session. Thank you so much, all.
And thank you so much, Dr. Salamanesh, for being a great moderator and asking very important questions. So we want to thank you also for the amazing work. Thank you.
Thank you so much. I really enjoyed the sessions and for this discussion. Thank you so much for inviting me.
Thank you, Salamanesh. Thank you.
Thank you. Thank you so much. We can close here.
Thank you.
Bye, everyone.